Good morning. Now I would like to start by, my name is João, and now it's my presentation. I would like to start by thanking the opportunity to share our little experience with hyperthermia in Portugal that has started around 3 years ago with LocalRegional and WholeBody hyperthermia. So we know that hyperthermia has been used for several years as complementary treatment, mainly for cancer patients. And there are several randomized trials showing its efficacy either with chemotherapy or radiotherapy. But we have such data, and until 2015, it was not known in Portugal, and there were no devices of either local regional hyperthermia or whole-body hyperthermia in Portugal until this year. And my goal here is to show you the evolution since July 2015 until the end of 2018 in the treatments in Portugal. So hyperthermia started in the north, in Porto. The first device was a capacitive local region hyperthermia on July 2015 in a private hospital in Porto. And it was followed in the same hospital by a whole-body hyperthermia device in August 2017. And shortly afterwards, in the south, in another private hospital, there were two devices, one of local regional and whole-body hyperthermia. And finally, in the end of December, beginning of January 2018, it's where I work in Lisbon, a whole-body hyperthermia device was implemented. So regarding local regional hyperthermia, in July 2015, we started slowly in Portugal with 68 treatments. This was treatment unknown and really reluctant from the medical oncology and radiotherapy community to accept in the beginning. After showing the first patient's results and with good results, it have become more accepted. And in 2016, we increased it to 292 treatments, and in the next year, 465, and in 2018, 368 treatments. This is including only Porto and Lisbon, because unfortunately I could not get the data from the south in Algarve. This correlates to 145 patients. In 2018, it's a little bit decreased, mainly probably because of the introduction of whole-body hyperthermia in the same hospital. So most of the patients were female patients, around 57%, with a median age of 68 years old. As probably is normal as we're starting a new therapeutic option in a country that does not know it initially, mainly all patients had 4-stage disease cancer. I put here the most prevalent diagnosis being breast cancer in 38% of the treatments, colorectal cancer in 11%, head and neck cancer in around 10%, central nervous system in 9%, and pancreatic cancer in 6%. Moving on to whole-body hyperthermia treatments. Again, this is data from Lisbon and Porto, not the south in Algarve. It started in August 2017 in Porto with 81 treatments, and it moved on in the next year to 228 treatments. And this will correspond to 72 patients being treated with whole-body hyperthermia. And this is half of the patients were female, half of the patients were male, and with a median age of 57 years old. Here, all patients were stage 4 disease, and mainly patients with highly extensive disease that were treated. They came for hyperthermia in 3rd, 4th, 5th line setting of each of the pathologies. And the main diagnoses were colorectal cancer in 29%, breast cancer in 16% of the patients, pancreatic cancer in 16%, and gastric cancer in 8%. as we have a short follow-up period, and initially data was not collected for progression-free survival, and there are several different pathologies and overall survival and tumor response, we are doing that now, and I hopefully can bring you data in next years of that. But from now, I can show some good responses of clinical cases that we have, and mostly the experience has been really good with patients being really satisfied, and also the medical oncology community, as they see the results on their patients, they're accepting more hyperthermia, and they are the ones searching for it now. So we're shifting a little bit here in Portugal. I can show a few cases of patients treated with recurrence of breast cancer in a previously radiated areas with complete response after the association of radiotherapy with hyperthermia. This is one patient, another patient with the same results. A good local control in an extensive disease. I already showed you some pictures in the previous presentation about head and neck cancer patients treated in Porto. And also we have good experience with whole-body hyperthermia. I will show you one of the cases, of the several cases that we have with good experience. A female patient with 44 years old. She had a left breast cancer with extensive lymph node, hepatic and bone metastasis. It was hormone receptor positive. And she started third-line chemotherapy with capecitabine and whole-body hyperthermia. She has done in first line a duplet of chemotherapy with carboplatin and paclitaxel, and she had a small partial response, but maintained with extensive disease. Then she did hormonal therapy in second line, and in third line with capecitabine alone. After these treatments before, we would not expect a big result. Of course, this is one patient and could be of capecitabine, but we are not expecting these results on that. So she had almost a complete response after this association. And as this patient, we have several other good cases, also including patients that had maintained the same treatment. I have a patient with colorectal cancer. She's maintaining FOLFIRI plus bevacizumab for 6 or 8 months with stable disease and have disease measures. And when you introduce whole-body hyperthermia, the measurements of the disease go down, and she actually became possible to be operated. So we're having really good cases and with responses better than expected for the conventional second, third, fourth line treatment in these cases. So to conclude, the use of hyperthermia as an adjuvant treatment in metastatic setting is progressively growing and associated with chemo and radiotherapy. But we do need more phase 3 randomized trials to establish its usage for everyone, to have probably reimbursements for these treatments in Portugal, and hopefully to treat better our patients. So, thank you.
Thank you for the nice presentation. Are there questions? I have a question. Is there, in your example, is there a positive interaction between capecitabine and hyperthermia? Do you have literature to that interaction?
Not so many literature, especially with whole-body hyperthermia, but as in Lisbon, patients came in last line, and not only on breast cancer, also in colorectal cancer. And we have, it's not one or two, but the chemotherapy that we see the best association in clinical practice, we do not have previous data, is with capecitabine. So most of the patients that had associated hyperthermia with capecitabine, they had a really good response, and a bigger response more than expected with capecitabine alone in these lines of setting.
Thank you for your presentation. I was especially triggered by your last part of the last sentence of your conclusion. Phase 3 trials are needed to establish the position of whole body hyperthermia. Are you planning? Do you have any plans in that direction that you want to share with us at this moment?
I would phase 3 trials to start with in Portugal. I think it's a little bit hard. We need a little bit previous evidence, especially on the right time to do whole body hyperthermia, on the schedule in which we should do it. But I'm hoping that from next year on we could start doing some like 20 patients initial trials comparing to standard of care to be able to start doing that and hopefully get good results and funding to do a larger phase 3 trial.
Coming back to the capecitabine, this is really interesting, as capecitabine is in fact one of the strongest depleters of myeloid-derived suppressor cells within the tumor. The dosing and the schedule of the capecitabine, is that a 3-weekly dose on 4 weeks, or did you have another capecitabine dosing?
Yes, it was
3 weeks on
yes.
4 weeks.
I have one last question. You saw some pretty good results for palliation. Do you have a reimbursement for these good results in Portugal?
No, we still don't have any type of reimbursement for any treatment associated with hyperthermia until now.
Thank you.